Hi, my name's Dave Rigby. I'm the realistic medicine lead for the Western Isles. I'm sitting outside my house here on a glorious Sunday afternoon with the sun shining, beautiful winter sun. And on days like this, it makes you think that how can there be any problems relating to living in such a gorgeous place? So in terms of realistic medicine, this village I'm in has 6 inhabited houses, and that's not uncommon on the island, although there is obviously the bigger town of Stornoway. But although we live in such an idyllic place, that in itself brings lots of problems. We are remote from access from a lot of the major centres, so gaining access to specialist care can be difficult. And in addition to that, we have significant problems finding home care. There's a lot of social isolation, and those are the challenges that face us with the realistic medicine agenda that we're trying to tackle at the moment. So, what does realistic medicine mean to me? Well, I think the main underlying principle is that we're looking to give people personalised care, and that really means that each individual may or may not fit into the hundreds of guidelines and protocols that we're swamped with every day. We need to think about what matters to that patient, in the full knowledge that what does matter to them will change from year to year depending on circumstances, and those circumstances will relate to their health, the family's health, the functional status of what they can and can't do. So we plan to do a lot in the Western Isles and throughout NHS Scotland to ensure that each patient is treated as an individual from a health and social care point of view, right across the specialities involved. We know to do that we need to empower staff within the NHS and social care. There is a really risk aware and at times risk averse approach to healthcare, and that is obviously essential, but we need to empower people to again look at the individual in front of them and appreciate that it's not one size fits all. And even though there may be risk, that person may be better served at home or in a homely facility rather than being in hospital. So I think they're the main things that we need to focus on. We also need to realise that the envelope we have is the envelope we have, and we need to make sure that we make best value of that. And that will mean releasing resource from some things that don't give the same value so that we can invest in quality improvement in other areas. It's a great challenge to be in this post, and looking forward to hopefully making a big difference with all our colleagues over the next few years in the NHS in Scotland. Thanks.